Hello, Syngap land. My name is Mike Graglia, and this is Syngap.10, the Syngap.One podcast. This is episode 153, and today is Saturday, November 2nd. A lot of great stuff, especially 2 studies and a trial that you can participate in. First study is the Fraser study. I've talked about this before. If you are anywhere in the developed world speaking English, please take part in the Fraser study. All you need is a computer at home. It is super important. This is a study that puts images on the screen. It tracks the participants' eyes with the camera on the screen, just like the camera I'm talking to you with. The more participants who take part in this study, the better data Dr. Fraser has, the more likely this tool is likely to be used in clinical trials. Why does that matter? Because the patient doesn't have to speak, right? Because it's eye tracking, it's ideal for nonverbal autistic, it's ideal for our population of Syngap.One patients. I'm begging you guys. There are 400 plus patients in the United States. I want everybody to be signing up for this. Right now we have about 50, so I need at least twice as many. Email khuba, K-H-U-B-A @jcu.edu. Get signed up for that trial. Participate. It's so very important. Another trial, if you're across the pond in the UK, the Changes study is available at Edinburgh. Very exciting stuff. There's a link in the show notes to our website. I think they've changed the age range. Now it's a little bit older. It's for adults. So if you have an adult in the UK and you want to participate in the Edinburgh study, please do. It's very exciting. And a trial. Difference between a study and a trial. Study is research study. Trial generally involves putting a drug in a kid and seeing what happens. So our friends at Stanford, not the Dr. Knowles and Dr. Lee Messer, but another doctor at Stanford is doing a pregnenolone study. Pregnenolone is a neurosteroid. It is available over the counter. You can order it on Amazon. I just did. And what it does is they're testing to see if it helps with irritability. Anyone know any irritable kids with autism? Like everyone, right? And the age range is 14 to 25. So we're going to send an email out to 14 to 25 Syngap patient parents on Monday. But I really want to encourage people to participate in this pregnenolone study because I would love it. It's not a Syngap study. It's a study for patients with autism who have irritability. Most of our patients have autism and irritability, so I'm really excited to share this with you. It's an over-the-counter supplement. At the end of the trial, they're going to tell you which brand they're using. If you want to keep using it, you could. This could be a way to, use something that's within reach to help your Syngapian today, contribute to science, and get another one of these rock stars, brainiacs at Stanford to learn about Syngap.One. Everybody wins. Links in the show notes. Speaking of cool science and repurposing drugs, we put out a press release last week, this week, whatever, on Professor Chow. You heard Dr. Chow speak at our meeting last year. You're going to hear him speak this year. You heard about NAL. Many of us tried NAL. Really exciting work that's coming out of the Chow lab, and we finally put a press release out there to note all the work we have done. Please check that out. Please feel free to share it. Also amazing science. We had Professor Sohal from UCSF, another exceptional institution, do a really fabulous webinar on Thursday, and it's going to be on our website. I share that link. It's already on Facebook because we live streamed to Facebook. Go ahead and watch that. I mean, it's one of those things where the science is really elevated. It's really next level what he's doing. But what's beautiful about this webinar is Professor Sohal really explains it so beautifully, and it makes it accessible even to those of us who last time we took a science class was in like junior year of high school, right? So really an excellent webinar. And what's cool about it is you can tell by the end of his presentation, this guy is a next level rock star, and he's working on Syngap. And he's working on Syngap. Why? Because you donated to the fund, and we met him, and we funded him, and we convinced him that Syngap was worth his time and attention. So what's also cool is it's translational. So he's looking at a specific kind of brainwave and seeing if a certain kind of drug helps our patients, and he explains it better than I do, but it's really amazing stuff. And if you enjoy that, you can get a lot more at our conference, which is 1 month away, December 5th in LA. The agendas are up. If you are registered, I want to encourage you to make a reservation for dinner on Friday, right? So the drill is Science Day on Thursday, free reception on Thursday night. I'm going to put that reception link in here too. Friday is dinner. Thursday is reception. And so Thursday night, free reception, drinks, everything at the hotel. Friday, family day. Friday night, we have what's called family dinner or community connect. I don't know. We keep changing the name. But the point is, Friday night, we have a big dinner. We've booked out this restaurant that is directly under the hotel, so you don't have to go anywhere. It's really worth it. We're losing money on the dinner, to be clear, right? People are like, oh, these tickets are $50. Yeah, trust me, it's costing us a lot more than $50 a head for these. You're going to have an amazing dinner. All Syngap families in the room. It's always a great event. Please come for the conference, come for the drinks on Thursday night, come for the dinner on Friday night. And then there's this cool tile that Ed has done. I share the link on X, aka Twitter, where we just flash through all the different speakers. It's really great work. Ed and the comms team are just killing it. So there's going to be a lot of great science and family and connection in 1 month. If you're like, oh man, I wish I'd registered. No, I want to go. Call us. We'll figure it out. You probably won't get a t-shirt because we've ordered the t-shirts, but we could still probably squeeze you into the conference. It's going to be an amazing gathering, and I encourage everyone. I got an email just last week from someone who's just diagnosed somewhere. I don't even remember where. I said, just come to the conference. All your questions will be answered, your community, your everything. You guys have to remember, 6 years ago, when Tony was diagnosed, I had none of this. None of these trials, none of this opportunity, no podcast, no conference. It was a very different world, and it was a scary place. And it's so much better now. Please come and be a part of making the future better for our kids. Speaking of making the future better, it's all about research, guys. Science is how we're going to do this. There are 304 papers on Syngap.Fund. That's gone up one since my last podcast. 46 of those 304, roughly 15%. Yeah, slightly more than 15%. Were published this year. 46 papers this year. The most recent one came out of Canada, where they looked at Syngap.Fund prenatally and perinatally, so really in the beginning of life, and how that affects auditory function, social behavior, and fear extinction. Anyone have Syngapians who are afraid of nothing? This paper explains why. It's just really cool to see all these different labs cranking out research on Syngap. You can tell, if you click on the link in the show notes, you can see the uptick in Syngap research. A lot of people are paying attention to Syngap, guys, and that's a lot to do with the fund and this patient community saying to researchers again and again, help our kids. What does it take? Let's get to work, Professor Sohal, Professor Chow, et cetera, Professor DeCristo. Professor DeCristo, I will note, who's the last author on this paper, did have a small support from SRF to do some Syngap mouse work. So we're touching a lot of people, guys. And it all comes down to fundraising. Coast to Coast Challenge is on right now. We're up to $92,000. That's technically a contest between me and Suzanne Jones. In fairness, Suzanne Jones has raised most of that. Ashley and I are still sending out our letters. We're going to catch up. But that's an important thing. If you're anywhere in the U.S. and you want to support us, join the Coast to Coast Challenge. It's giving season, guys, November, December. This is when you can ask people for money, and we need to, because we got a lot of grants that just came in. There's going to be some trade-offs made. We're not going to be able to fund them all right now, I'm sorry to say. And I'd like to fund more than we're going to be able to fund. There's a lot of cool science going on. We need to raise more money. The Missense account for the fund, dedicated funds for Missense, is at 25,000. Charmander's over 10,000. Emmy's over 8,000. All exciting. One way you can raise money for SRF is by Minted. If you do Christmas cards, we have a code in the show notes, FUNDRAISE Syngap. I mean, why don't they just use Syngap.Fund? Something tells me that wasn't taken, but whatever. You get a 20% discount on your cards, and SRF gets 15% of what you spend. So that's a little freebie, right? You get 20% off, and we get a small check. It all helps, guys. So if you're doing Christmas cards, use Minted. Check out that code. I want to again congratulate John Hill, who was the MC and the host of the gala alongside Nancy Lieb-Kessler. I really sang Nancy's praises 2 weeks ago, or 2 episodes ago, but I failed to mention John Hill, who's really come in there and has done a tremendous job driving the gala as well. I apologize for that, John, and we're grateful for your leadership there. Also, we have a blog up on the Scramble. The Scramble was done in South Carolina by Julie Miles and her husband for their son Miller. Awesome event. Check out the blog on the Scramble. A couple other things real quick. There's a lot of Zoom meetings happening. I got a lot of people being like, Mike, where'd you get that cool Zoom background? Links in the show notes. Download the Zoom background. Represent SRF. As always, if you're watching this for the first time and you want to be a part of the solution, after you do a fundraiser, call us, volunteer, become a part of the team. The SRF team is cranking on all cylinders. We have so many people doing so many things. It's super duper exciting. Last but not least, social media. I'm actually going to do this under time. Social media matters. I got links in the show notes. Follow us everywhere you can find SRF. Help amplify our message and grow our tribe. Thanks for listening.